Tizard Center. For those of you who do not know me, I'm Thanos Postanis. I'm a lecturer here at the Tizard Center, and we offer verified course sequences in applied behavior analysis and positive behavior support. We have sequences that are relevant to ABAI accreditation and the BACB accreditation. And we also have courses that are relevant to the UK Society for Behavior Analysis accreditation, the UKBA cert, as we are now called here in the UK. So if you know folks who would be interested to study applied behavior analysis and positive behavior support, or if you are considering studying with us, do check out our website at www.tizard.org, where you can find information about our courses. We also have a peer-reviewed journal that focuses on individuals with intellectual disabilities or learning disabilities, as we call it in the UK, the Tizard Learning Disability Review. And we always encourage submissions from colleagues, either submissions that focus on a case study or a more robust research project, or even viewpoints and policy reviews. By all means, submit away and check out the Tizard Learning Disability Review. Finally, we have PhD opportunities. We're currently advertising a fully funded PhD scholarship for full-time or part-time studies with us. So if you're interested in pursuing research in the field of behavior analysis and positive behavior support, or subfields of behavior analysis, we have colleagues that have expertise in PBS, colleagues that have expertise in feeding needs. We have colleagues that have expertise in precision teaching and instructional design, and so on and so forth. So you've got plenty of options. Okay, enough of me plugging anything related to Tizard Center. We are welcoming Dr. Matthew Lewon today to our behavioral talk. It used to be called the Journal Club. We've rebranded. We're calling it the Behavioral Talk, just to make it a bit more precise in terms of what we're doing. So, Matthew, I would like to start by asking you to talk to us about something that you're currently working on. People have already read your impressive resume in the flyer. So, if you want to share with us something exciting about your current endeavors, and then take it away, I will be monitoring the chat, and I will deliver 3 keywords for the CEU. Folks, make sure you write those keywords down, because you will need those if you're claiming your CEU at the end of the session. Matthew, thank you.
Thanks, Thanos. Thank you for inviting me, and thanks to the Tizard Center for putting this together. Something I'm excited about, I won't talk about it today, but you know, we're working on a mouse model of autism, so which is an interesting sort of thing. The question is, how do you model autism in an animal that is not verbal? And so we've been kind of working with researchers outside of behavior analysis who are interested in, you know, discovering the genetic, environmental, and epigenetic causes of autism, which would be nice if we knew that. And so we are working with a particular model where we expose parents to anesthesia that are common, anesthetic agents that are commonly used in pediatric surgery. And then in their offspring, we're looking at these really basic processes such as habituation, simple operant learning, discrimination learning, and then social reinforcement, where an animal can respond to interact with another, and putting these all together to kind of try to develop an animal model of autism that is more based on learning research rather than some of the behavioral phenotyping procedures that have come from places like neuroscience and stuff. So we're kind of excited about that. So at the end, I'll have my email address. If you're interested in learning more about that, I can, you know, shoot me an email.
Brilliant. All right. That is actually super exciting.
It's fun. So I will go ahead and, if it's cool, share my screen here and,
yes, and
go for it.
Go for it. We can see everything fine on our end.
Excellent. So my talk today is talking, you know, starting at the end. So the end is the beginning, tying applied behavior analytic treatment methods and goals to consumer contexts. I'm at the University of Nevada, Reno. Some of the stuff that I'm doing right now, my animation was funky there. I'm an assistant professor in the psychology department. And as you can tell from the thing I said, one of the things I'm excited about, we do basic research with mice on basic learning processes and the contextual control of behavior. So we're going to talk a lot about context today. But at the same time, I also have a contract with a local school district here, and I have 7 graduate students who work with me in the school district. We work in 3 different schools. One of the schools is primarily for students with intellectual and developmental disabilities, and the other 2 are students with emotional and behavioral disorders who exhibit behaviors that are so disruptive that they're placed in these sort of what we call self-contained school settings. I have a list of my pre-doctoral applied behavior analysis experiences here, and this isn't to brag, but I just kind of wanted to sort of give you the idea that I've kind of worked in a lot of different settings, in a lot of different cultural contexts. So I've, lived in Japan for several years. I've done BCBA supervision and training for students in Saudi Arabia, and then across time. So you can see I kind of stumbled upon behavior analysis in 1999. So I've been kicking around for a few years here. My first experience was interesting because it was in Arizona, in the States here. We were kind of behind the rest of the country in deinstitutionalization. And so I happened on as an intern right as we were closing up the last of the state institutions in Arizona. And so that was kind of an interesting thing to observe, the transition of the last 200 people out of Arizona's last institution out into group homes and things like that. And so I just sort of mention all this to say that I've kind of had an observation point across a bunch of settings, different countries, and across time. And I'll kind of go from there to sort of lay out kind of what the main point or the main assumption of this presentation is. And I don't think that anybody listening here would, find this super shocking or surprising. But the idea is that everything that we do is due to our own personal contexts, and that includes our past, how things are arranged right now. And then I think, especially germane to what we're going to speak about today, the relationship between the two of those, between what has happened in the past and how your situation is arranged in the present. This also probably doesn't surprise anybody, but, from my view, the understanding behavior of others, requires an understanding of context. And the more you know about a person's context, the more you understand about what they're doing, why they're doing it. And so I wanted to kind of lay out some things, acknowledge my own context here. One is that I provide university-based services. So a lot of the contingencies that are relevant to running a business and things like that, those things don't really affect the services that I oversee. 2, these days I work primarily in public schools. So, some of the things I'm going to be talking about are kind of coming from that perspective, and you all who are listening probably have are working in different settings, but maybe some of this, you can see some of this stuff in the settings you're working in. 3rd, I need to acknowledge that I live and work in the United States, and so things are set up differently here than they might be where you are, and so I acknowledge that. And again, hopefully I think that some of this is relevant to the contexts in which you're existing. And then the last thing I want to say is much of what I'm talking about here is kind of aspirational in the sense that it's hard to do. And so it's, I don't like these talks where everybody's like, should, and it's kind of like I'm doing all the right stuff and I'm telling you what you could be doing better. This is as applicable to me as anybody else listening here. So these are things that in my own career with my own sort of place of practice, this is kind of what I'm aspiring to. And I'll admit that I haven't done all of this yet, but I think this is where we should go. So what are we trying to do with ABA services? I think that, a lot has been said about what ABA is, Bear Wolf and Risley and all that stuff. But I think you can boil it down to two things. One, we're interested in social validity. So we're interested in providing services that are deemed acceptable and important by consumers, stakeholders, and our communities. The other thing is socially significant behavior change. We're all familiar with the term social significance. And sometimes I think a little bit of nuance is lost there, because I think sometimes, at least in my experience training graduate students, there's some conflation between social validity and social significance. And so from my view, I'll suggest here that social significance is a part of social validity, but there's more to it than that. And so we'll talk a little bit more about this issue down the road here. So I showed you all the things, the experiences that I've had, and kind of the observations that I've had across time and across settings that kind of occurred to me and occasioned what I'm talking to you guys about today are a few things. One is, I feel like I see in my own work too, a frequent failure of treatment, generalization, and maintenance. So you teach something, but then it doesn't show up. It isn't maintained across time. And some of these things can be really sad, where, a person has gone from service provider to service provider throughout their whole life, and none of that stuff kind of shows up anymore. Second thing that concerns me is a failure to demonstrate or measure meaningful impacts of treatment on consumers' lives outside of treatment. So I think, one of the things that tends to happen is we as clinicians kind of impose upon our consumers what we think is important, without considering what their lives are going to be like after we're not in their lives anymore. And then a lack of demonstration of meaningfulness, and I'm painting with a broad brush here. I'm not trying to poke, but this is kind of something that I see. A lack of demonstration of meaningfulness, in the sense that there's no measurement of how what we're teaching improves the quality of lives of people outside of treatment. And related to this, I think that sometimes there can be a lack of consideration of post or non-treatment life of consumers. So these are the sorts of things that have occasioned my comments here. And so now I'll start at the end, like I'm asking us to all think about what's the purpose of this presentation. First, ABA treatment decisions, goals, and methods, in my view, should be tied to the purpose of treatment, which is the thing that is at the end. And a corollary to this is that the end of treatment considerations then should be a part of all the treatment phases, the decisions that you make all throughout. So I'm going to take a conceptual detour here to talk about context. So this is something that I'm interested in, a conceptual sense. It's a word that's thrown around a lot. We all kind of intuitively understand this concept, but the fact that it is so intuitive, it runs the risk of becoming like a garbage dump of concepts. What counts as context? Well, it's everything. Well, is it everything? So we kind of need, I think, to think about what context is. And the definition I'll throw out for you guys to consider today, and this is just kind of what I'm going. It's not the definition, but it's a working one for what we're going to talk about. It's just all of the factors that affect the behavior of an individual at any given moment. So it's not everything, right? Because there are tons of things that are happening around you right now that you could, in principle, be attending to or behaving with respect to, but you're not, right? So it's the things that are affecting your behaviors at any given moment. Kind of going further down this road, that means that context is constantly changing. If you kind of think of what you're attending to and behaving with respect to, that kind of fluctuates across time on motivational circumstances, attentional issues, things like that. And I'd like you to kind of maybe imagine that as you are behaving, so is context changing, right? It's not a static thing. It's a psychological thing. And then I think that most germane to what we're going to talk about in the rest of this talk is that what counts as context, what acts as context, is individual specific. So you and I could be sitting in the same room right here looking at all the same things, but the things you're behaving with respect to are going to be different than the things that I'm behaving with respect to, even in the same physical setting. I like the term context a little bit better than environment, just because it seems broader to me. So of course, we're all comfortable as behavior analysts with sort of recognizing that the external environment, constitutes a part of that. But context, I think, includes things like temporal relations between events, so how things occur together in time. The behavior of other people, imitation is a really obvious example of how the behavior of other people is related to ours. Here's one that I don't think we have a funky way of talking about it still in behavior analysis, is our own behavior. We behave with our own behavior as a part of the environment too, a part of the context, I guess, right? So like when you wave your hand in front of your face, that produces some stimulation that you're behaving with respect to. And then you go further down that road and you talk about language and verbal behavior, you're talking to yourself all day long, right? So, and that's all a part of your context. And then lastly, and I get some flack from some people about this, but what's happening in your body is also a part of context. Skinner had no problem. That's the whole thing of radical behaviorism, is like, yeah, your body, there's stimulation arising from your body. You can behave with respect to it, And so I want to just finish this by saying that context just is a field of all of these things. Sometimes we all know the three-term contingency is very useful, and there's nothing in the three-term contingency that precludes thinking about things this way. But just in my experience, when you're talking about A, B, C, when I'm teaching that, people tend to think about the antecedent being one thing, when it's really a field of things, which I'm calling context.
So interrupt you there for a second, Matthew,
yeah.
Just to provide the first keyword, folks. The first keyword for your CU is context. Nice and easy. The first keyword for your CU is context. Thank you very much.
Thank you. So if you go now, let's think about context in the context of ABA service delivery. It gets more complicated. So one thing you have to be thinking about is all the things that are going to affect consumer behavior, which that's okay, fine. But this is something that I think is interesting too, and I just never really thought about it, articulated it, I guess, is that you not only have to think about the things that your consumer is behaving with respect to, but also how their behavior will be perceived and or its implications in their broader context. So for example, if there's certain behaviors that are happening, those behaviors might prevent a person from being able to access certain environments. And I think about the kids that we work with in my schools. They are placed in these self-contained schools rather than general education because of the behaviors that they exhibit. In the thinking about ABA service delivery, you as a provider, your context is an important part of this too. There are financial considerations. So you're going to get reimbursed by insurance. How long is that going to take? If it's not an insurance thing, can the family pay? Staffing and training. Do you have enough people? Are they trained? How do you train them? How much time do you spend on that training? And then there's your scope of competence, like what you've been trained to do. There are certain behavioral issues that I get really antsy about not wanting to, I'm not an expert in feeding, for example. So that's not really something I would be able to take on But then there are also things like language and cultural issues. So if you're, I'm thinking about Nevada here, we have a lot of families, a lot of consumers here who are primarily Spanish speaking, and I don't speak Spanish. And so these sorts of issues are important to consider and constitute a part of the service delivery context as well. So I'll go back here, represent the purpose. Our decisions in treatment should be tied to the end of the treatment process, and those considerations should inform your decisions all along the way. And so now I'll put some concreteness to it. So what are some, I kind of broke it into 3 areas. There are more than this, I'm sure. But I'll talk a little bit about generalization and maintenance. I'll talk a little bit about social significance. And then lastly, we'll talk about the very end, like when you're finishing up services, what sorts of things are going on there. So at the risk of telling you things you already know, let's just get on the same. I just like to give the definition so we're all on the same page, so you can kind of know what I assume about these things. But when we're talking about generalization, at least in the context of this talk, talking about behaviors acquired in the context of treatment start to happen in non-treatment contexts without explicit or direct training. When we're talking about maintenance, behaviors that are acquired in treatment occur across time. And this is kind of related to generalization in the sense that time is not an independent variable, it's change, right? And so you assume that, if behavior continues to occur across time, it's continuing to occur across contexts. In ABA research, and this is one of these things, maybe I should have taken this bullet point off, but I'll say it. In ABA research, sometimes I feel like generalization and maintenance feel like afterthoughts. It's kind of like, you think of all the Java articles you've ever read. It's like they do the thing, and then there's like a generalization check and a maintenance check, and it maintained 3, and there's no problem with that. I think that that's a really good thing. But for me, that is the most important thing in application. It is the most important thing. So I will resist going on a rant here because, again, this is an aspirational thing. I can't say that I have done differently, but I just think that that's the main thing here, right? Is that behavior change is not socially significant or meaningful to consumers unless it generalizes and is maintained across time. And so to me, that is the ultimate outcome of what we're doing in ABA practice. Some things to I'll point out here, and again, we'll have time for questions and comments at the end, and you can kind of tell me how you feel about this. But some common ABA treatment contexts present significant challenges to this. So I'm thinking of center-based in particular, but also home. I did 4 years of home-based services, and even in the some of the rationale behind the home-based stuff is that you're teaching in the context of the child's living environment, and that's great. But any of you done home-based services, I don't know how it looked for you guys, but like for me, we were training in a particular room most of the time, and we were trained. I was, me and 3 other tutors were the people delivering this, the education. And one of the things that we saw a lot was that we train, and then the skills we were teaching didn't show up with the parents in the house, or didn't show up with the siblings, and then you take a step further, it didn't show up at school, right? So there are, even in home-based sorts of situations, you have to worry about this issue of generalization. There's also been, I think, a historical propensity of behavior analysts, and I would include myself in this, to teach in contexts outside of those in which behavior change is actually meaningful. So one of the things I struggle with all the time working in schools is I say to myself, I look at a student and I just was like, God, can we get them out of this environment? You know? And that is as tempting as it is to do that, that's just not, A, it's not practical in most circumstances. And B, um, you want to train in the situation that is most like the situation in which you want these things to show up in a meaningful way for these people, So I've said this, but I think that generalization and maintenance consideration should be the end all be all of ABA treatment, and I don't know that it is yet. So you guys are probably familiar. Well, let me say this. So generalization and maintenance, I remember I mentioned in the first couple of slides, what you're doing right now is kind of due to what you did in context in the past, how context is in present, and then the relationship between these two things. And so I think that one way to kind of think about these things is a relationship between the context in which you learn something and then the context in which it's supposed to be performed. And so in some of this isn't really a behavior analytic, this isn't a thing that shows up too much in behavior analytic literature, but if you are interested in associative learning theorists like Rescorla and people they talk about learning and performance, so learning is where acquisition occurs, and then performance is kind of does this behavior show up in context later? And so when I'm talking about this, when I say learning context, I'm kind of speaking about these structured educational training contexts, these situations where we do ABA. And then the performance contexts are the situations outside of those where we ideally would see these behaviors showing up, these non-treatment contexts. And I think a general point to note here is generalization and maintenance really primarily depends on the similarity between the context in which somebody learns something and then the context in which you were hoping that they would perform it somewhere down the road. So I'll mention here a couple of different ways to do this, and you guys might be familiar with this, but one thing that has kind of been prominent for me in my thinking in working in schools is ecological assessment. So if we have a child, for me, I'm just using my example, if we have a child in a self-contained educational setting, I want to know what the general education setting is going to look like, right? Because what are the tasks that are going to be required of the child? How many demands are going to be placed on the child? What is the schedule and types of reinforcement that will be provided? Without any of that, I kind of am flying blind on it, right? I'm kind of training, and Stokes and Bear talked about one of the strategies for generalization is train and hope. But if you know something about where the person is going to be after treatment, and even better, if you can go in and measure some things about the environments that the context that the person will be in after treatment, that helps you make decisions about how you're going to do what you do. So you can kind of tailor treatment strategies to what you know are going to be the consumer's post-treatment contexts. So, we tend to use relatively rich schedules of reinforcement, pretty powerful reinforcers in treatment, but a lot of those things are very different than what the person will encounter outside of treatment. So that's one thing I kind of think, ecological assessment is not a new idea, but it seemed in doing a lit review for this presentation I found a lot in the 80s, and it just you don't see it a whole lot. It's in the white book, but there's references to the 80s. So I just kind of kicked this out there. Maybe this is something that, inspires you all to think about your situations. I'm kind of, with my students doing research in the schools, I'm like, this sounds like a really interesting thing. How can we measure what's going to happen in general education, and how can we use that assessment to inform what we do with them in the self-contained settings? So maybe sometimes it's impossible for you to know what the environment into which a consumer will go post-treatment looks like. And that's possible. One is it's impossible to know, right? You might not just be able to know because people's lives change all the time, right? Family situations change, teachers change, all these sorts of things. The other is that you don't have the resources, and I think this happens most frequently. It's like you don't have the resources to go in and do a post-treatment ecological assessment. That's a very real practical thing. And so, the literature suggests several ways in which we could actively program for maintenance and generalization in the absence of any knowledge about what the post-treatment situation is going to look like. And so just some here, and you can read these articles. I won't go into great detail. But using variable SDs during training and multiple exemplars, much of what we do is discrimination training. And if you're not varying your SDs, I think of my early intervention work with children, it's like touch, head, it's like very contrived, and that's important for early learning, but it has to loosen up. Hey man, touch your head. Can you show me where your head? All of those sorts of things kind of have to come into play. When you're, teaching kids to label vocally, non-vocally label items, you want to use lots of different pictures of cats, right? Real cats, cats on TV, all of those sorts of things. Something from my own research that has come up is training across motivational contexts. So we tend to, and I think it's a good thing, we contrive really kind of motivational circumstances. We really powerful reinforcers. We get all our EOs in place, but those might not always be in place in the child's the person's natural environment. So that's kind of something that we have to think about. Programming common stimuli. So if you don't know what the person's post-treatment environment is going to look like, maybe you can kind of train, have this obvious stimulus be a part of the context in which they learn something, and then that shows up prominently in the unknown post-treatment context. And then something to kind of think about, I feel strongly, feel like I could do a whole rant on this, but using different teaching methods, one part of me feels like, oh, it's great that we're sort of manualizing ABA treatment. It's like we have these assessments and this is how you do discrete trials, and all that sort of stuff. It's nice because, people can just come in and follow instructions in terms of these procedures. But I feel strongly that all of these things need to be tailored to the individual. And so one of the things that I really liked about my training was it was a very Lovassian program with discrete trials, but through the years it just got more and more flexible, right? And so for some children, we kind of stopped doing trial blocks, and we just distributed trials all throughout the session so they were all intermixed. And you can't do that with a brand new learner, but as you get further along, as you get close to the end of treatment, you need to be thinking about, like, am I creating a stimulus control situation that is too restricted to what I'm doing? And then the last thing I'll say in this section is mastery criteria. So, and I'll put myself in this category again, we have a tendency to rely upon predetermined mastery criteria. So like I see a lot in service providers around town, it's like 3 days in a row, 3 trial blocks in a row of 80%, it's mastered. Boom, we're done, But it's not clear how these criteria are related to maintenance and generalization. And so we need in our science to be assessing the relationship between the mastery criteria we're using and the main point of these things showing up in the real world. And so I have a couple of references here. This is kind of an emerging thing. Me and my colleagues have been talking about this for a minute, but it's cool that it's starting to show up in the literature here. So there's a couple of articles sort of talking about that relationship between the criteria you use for determining mastery and the ultimate real outcome, which is maintenance and generalization. So the second area that I wanted to talk about here was social significance. So I mentioned social validity. We kind of know what that is. But one thing I think that is important for us to recognize is that social validity as a measure of like somebody saying, I like this, I find this acceptable, this is great for me, is different from something actually being effective. And it's also different from the things that you're teaching showing up in a meaningful way in your consumers' lives outside of treatment. And so the working definition, again, it's not the definition. I'm calling social significance changes in consumers' non-treatment lives that occur as a result of the treatment process. So some things that kind of, this can get, from my own student, from seeing my own students' behavior, I think that it can get a little confusing here. I think, so a couple things. Treatment can be socially valid, but not effective. In other words, people like it, but it doesn't produce the behavior change. So I think for me, I was using a weighting for one of my research projects as a grad student, trying to teach children with autism to wait, right? And so I was using this percentile schedule procedure, and the kids didn't learn how to wait, but the parents loved it, and that probably had more to do with like my relationship with them than, what the outcome of my treatment was. Treatment can be effective, but not socially significant. So you can teach 8,000 things on a list, right? Go through the VB map and teach, all those skills, but they don't show up anywhere else, or, they don't come together in a way that produces, generative outcomes. And then, treatment can be socially valid and it can be effective. It can be both of those things. People like it. You're teaching a lot of skills, but then they don't show up in maintenance and generalization terms, right? So those are kind of things I think are important to kind of keep in mind. So social significance, how do we measure these things? I want to make sure that I stay on time, so I'm not going to go.
Can I interrupt you just to deliver the
Sure.
second keyword before you move on? The second keyword is social. The second keyword is social, folks. Thank you very much.
Social. So like how, I think that one question to be asked is like, Matthew, okay, awesome. Yeah, we need to think about the meaningfulness of behavior change in our consumers' lives. How do we do that? How do we measure that? So there have been, and I have some resources, some references here if you want to check these out. There have been some proposed measurements. One is normative comparison. So did treatment make a consumer look more like other people? There are lots of problems with that one, but I just list it here as this is something that has been suggested. Some of these are, I think, maybe more interesting. The amount of new reinforcers consumers can contact or access, the number of new environments to which consumers have access. So I mentioned that in some cases, certain behaviors can be such that they preclude a person's participation in other sorts of environments. So I think of, my students in self-contained schools versus general education. Could we measure the reduction in the danger or harm to the consumer themselves or others? Could we measure the increase in positive, and I know positive interactions, what does that mean? But, we could probably come to an operational definition on that. Could we measure the number of other individuals positively impacted by consumer behavior change? Could we measure the extent to which newly learned behaviors replace or interfere with undesirable behaviors? And, this has been talked about in terms of this last one, behavioral cusps or pivotal behaviors. So does the sort of, when a child learns imitation, for example, or when they learn how to walk, or when, all these sorts of things, like the world opens up to them, right? And so is there some way to measure that? So all of this, again, I mentioned at the beginning, this is aspirational. It's hard to think about how to measure these things, and it's hard to think about the logistical features of it, but I do think that we need measurement of the relationship between what we're doing in treatment, what we're measuring in treatment, and the post-treatment well-being of consumers. The difficulties are clear. It requires longitudinal stuff, so you need to be looking at the person outside of treatment. If you're doing practice, you don't really have insurance companies, families, might not be able to pay for that. Insurance companies definitely won't pay. But I think that's, again, I'm speaking in the context of the United States. One thing that worries me is that insurance companies are increasingly dictating practice decisions, and in the absence of our scientific measurement of what treatment does for people, the insurance company is just going to make an arbitrary sort of statement. It's like, well, you get 100 hours of ABA for this kid, given their situation. So, I'm not trying to paint a dire picture, but we need to get on the right foot on this sort of thing, because insurance companies aren't gonna, So I don't know what things are going to happen in other countries as this unfolds. Okay, so this is my last section here, termination of services. So one thing you kind of have to consider, the title of this talk, right, is The End is the Beginning. And so all things must pass. It's George Harrison record, right? I liked it because it's a catchy thing, but the provider, your relationship with your consumers is always going to end in some way or another. In the best case, it's like we met all our treatment goals and everything's great, but there are a lot of other circumstances. So I don't know what the guidelines are in the UK and other places, but here we have the BACB guidelines, and there are ethical guidelines here on the right-hand side of the screen related to this issue of continuity of services, making sure that you kind of end the relationship ethically, making sure that there's transitions in place when those are available. And in writing this article that I'm going to talk about with my other colleagues, one of the things that we kind of went and did is looked at what are clinical psychologists doing? What are counselors doing? Because behavior analysis is a relatively young, professional sort of group. And so these other groups have a lot more systematic stuff in place for the end of the provider-consumer relationship. And one thing we were struck by was just they think about the end being something that is a consideration throughout the entire treatment process. And so one of the features of this paper, we surveyed BCBAs in the United States, and I think that we got like a large amount. I think like 500 responded to it or something. And so what we found here, I'm just not going to go through all the results, but just some ones that were kind of notable to me in the context of this talk was that that behavior analysts, BCBAs, recognize the importance of termination practices and ethical responsibilities, but they don't feel like they are very competent in those. And I would put myself in that category after I finished with my graduate training. So they recognize that they have to do it for ethical reasons. They recognize its importance in the whole treatment continuum, but they don't feel super competent about it. And another thing that was notable to me and us was that most training in these sorts of things is happening in practice. So after you're out through your education and out through your supervision, now you're out and working for some service provider. That is where anything that you learned about termination of services is happening. And some of that's to be expected, because that's the place probably you will have most contact with the end of the service sort of thing happening. But you can imagine that when services end and you're a business, right, you're losing business. So there's like some conflicting contingencies there. And so maybe that's not the best place for most of your training about the termination process to be happening, is kind of what we were thinking. And so we, in this paper, and again, at the end of it, I'll have my email address, and I can just send you any of the papers that you're interested in here. One of the benefits of being a part of the university is you can just snag these articles for free. I was out of the university for a few minutes, and I was like, wait, how do I get these articles? I have to pay $40 for them, So if there's anything that you want, like, just let me know. I'll be happy to send it to you, because I just have it laying around. I'll just throw it on an email. But we talk about, so termination of services should be something, again, thinking about the end, should be something that you're kind of revisiting throughout all phases of treatment. And so some of the things, I won't just go through all the bullet points, I'll just kind of highlight some things. One is that I never thought of before writing this paper is a professional will. And so that's been called lots of different things, but what happens if you are incapacitated, right? So let's say you're managing a case and you don't have good records, and somebody now has to come in within your organization and take over the case, right? Or let's say in the worst case scenario, well, I won't even go there, but you see what I'm saying? Like, what happens to your consumers if something happens to you? That is an ethical consideration that makes perfect sense as I say it, but I had never really thought of it, If you're in an organization, you need to make sure that your staff is trained on these issues. So what is your policy as an organization for when termination happens, or when, somebody quits, or, all of these sorts of things that happen. And then, how are you documenting this? How are you communicating with your consumers about this? Because this is a whole other issue, is that you can't just pop it on, and I've seen this happen a lot, where you just kind of pop it on them. It's like, well, we're going to finish up services because we've taught everything that we know how to teach, and it's those, it's a little bit of a straw man that I'm building there, but I've seen it enough to think that it isn't totally uncommon. Thinking about termination should happen before treatment. So our ethical guidelines say that we, in our service contract with our consumers, we have to talk about the conditions under which services will be discontinued. And so the consumers need to be made aware of these circumstances prior to commencing treatment, because that's a part of the whole thing. Some of these other things, objective and measurable treatment goals and expected timeline. This is something that I don't know, I'd be interested in hearing people's thoughts about this, but sometimes I see providers kind of take on a consumer, and it's just kind of like, well, we'll just kind of teach, and once we teach that thing, then we'll teach this thing. Do you know what I mean? There's like kind of no cohesion, and it's like this assumption that this person will be with us for ever or something, and no sort of systematic thinking about, like, hey, what are we trying to accomplish here, and when can we say that we've accomplished it? During treatment, you should be ideally reviewing progress regularly. I mean, this isn't, I hope not news to anybody, but then adjusting, if you have a solid goal, if you have a solid purpose in treatment, then you can kind of sort of say, okay, here's where we are on this path to that endpoint. Do we need to adjust either the endpoint or our timeline for reaching that endpoint? And then you kind of always need to be asking yourself, in my view, like, is this kind of reaching beyond my scope of competence? So have I received, one thing that I've noticed a lot is, like, in early intervention services, a lot of those kids start nonverbal kind of, and then they get very verbal. And then once you have an individual who's very verbal, your world kind of changes a little bit. I'm not saying it's magic, but there are considerations that start to come into play. And if you haven't been trained to deal with things like the kid is looking at his own behavior and saying that he feels ashamed of his behavior relative to his class, that's heartrending, first. And it is also kind of getting into a different domain of service, right? And so if you haven't had that training, then you got to be careful around that sort of stuff, we tend to think about termination being sort of something that happens at the very end. And so this is these things, you know, who's the kid going to go to, who's the person going to go to next? This is a real problem. And I recognize, especially, well, here in Nevada, even, one of the problems we have is a lot of adults, there's no place for them to go. And so we're in a real struggle. Like when a kid gets to 21 here in our school district, they age out. And it's like, where are they going to go, you know? And a lot of people won't there's no place for adults to go. So, but we have an obligation to do the best that we can to kind of facilitate a transition into a setting that, you know, might be most appropriate. And then on all phases, you got to document the stuff. You got to involve the stakeholders. And then you got to be in communication with them regularly. You don't want to just pop it on them. And I know that that sounds like an obvious sort of thing, but again, this is something that I've just seen a lot, where it's like something is happening in the provider organization. It's not communicated with the family or the caregivers. And then boom, they're like, they don't know, you know, it's like, they're not informed that, you know, services are going to end. If you're interested, I know that people from different countries here are attending this, but this is maybe an interest, you know, BACB has a document about continuity of services stuff, which is really helpful. So it could serve as kind of a template for you. But I'll finish up here. I think I'm just about right on time for a few questions here. I'll just finish by kind of recapitulating what I said. You know, my dear friends, like, tell them what you're going to say the thing, and tell them what you told them. So ideally, behavior analysts are continually working themselves out of a job, right? And that's kind of a weird thing, but because of that, we should be carefully selecting treatment goals and methods that produce behavior change that's socially significant and generalized and maintained to consumers' natural contexts outside of treatment. And these end of treatment considerations, in my view, should provide the framework for everything that happens in treatment, right? So the end is the beginning, which is now the end. So this is my email. Please email me with comments, or if you need an article or whatever you want to email me. And any questions that you have, I think we have 5 minutes to do that. So
Matthew, thank you very much for this. You've raised some really valid points. Can I just say, folks, the third keyword for your CEU is services. The third keyword for your CEU is services. I've got a couple of questions already in the chat, and folks, by all means, please type away your questions and I will read them to Matthew. Could we start quickly with the word treatment? Someone says, my education is that ABA-PBS is not a treatment. Am I correct to assume, Matthew, that you mean something along the lines of intervention, support, or something along those lines?
Yeah. I always go back and forth about what the best word is, you know. So yeah, that's what I'm referring to.
We've got another, it's partially a comment, partially a question. I was part of a project meeting today with the Royal College of Speech and Language Therapists, who have a message of ABA that is not really positive and uses the historical application of ABA as negative. And that, you know, in a way, ABA is portrayed to be an element of, I suppose, a system of support or something along those lines. But the person says, you know, in my opinion, everything is based on the science of applied behavior analysis. So how do we change this narrative?
Yeah, that's a good question. In the school district, we have to collaborate with speech language pathologists and occupational therapists and school psychologists, and that's kind of always the line that we're trying to walk. And the tack that we've taken on that is, you know, we kind of do something that they can't really, you know. So I think about what a speech language pathologist, you know, if I'm being really frank, I'm like, we could do that, you know. And I think that one thing that I kind of always try to keep in mind is, like, there's a distinction between what to teach and how to teach. And so we try to defer to the experts, our related professionals in the school district in terms of what to teach. And we try to take every opportunity that they give us, and they eventually give us one where, you know, they're trying to teach something it's not working, you know. And so I think that we've been most successful in collaboration with these individuals when we take that tact, where it's kind of like, well, you're an expert in what you want, you know, like we don't teach the schools what to teach, but when they're having trouble teaching it, then we are able to be useful to them. And so I think that that's maybe something that's not super satisfying. It would be nice to change the narrative like that, because I do think it is a misunderstanding. But, you know, change is slow in these sorts of things. And so I would just say, you know, to finish off my response to this, I think that we haven't been super good at this either. You know, I think that the reason why SLPs and OTs and stuff have an emotional reaction to behavior analysis is because of the behavior analysts that they've interacted with them in the past who have said, we know everything, it's all behavior, you know, it's not a big deal. I think that it's important for us to recognize their expertise that we don't have in some circumstances.
Thank you, Matthew. I'm always taking into consideration something that a good colleague of mine has always said to me, that as you said, we need to become irrelevant as soon as we can. And I do appreciate your point that sometimes we don't really focus so much on, okay, when do we discontinue services and how can we plan ahead so that they don't need us? I think we sometimes are so immersed in the fact that, you know, the people we support tend to need quite a lot of hands-on support from us, that we kind of miss the point of why we do what we do. And it's very interesting. I always thought that that is a valid point, and I don't really hear that often in our world, people discussing. And I remember, for example, once I was discussing a case, and the first thing he asked me was, when are you going to finish? I was like, I just started.
What do you mean?
Yeah, okay, when are you going to finish? When are you going to finish? Trying to get across to me that, you know, that's, you know, you need to become irrelevant as soon as you can for this person. We've got a comment. Thank you, Matthew, for the insightful materials. I love how you pointed out context and make it broader in a sense that we have to really consciously be aware about what are the goals we're putting on as you know, support and treatment for our consumers.
Cool.
Okay, folks, I
Thank you.
posted in the chat the links for the CU form and the feedback form. So please make sure you click on those. I don't see any other questions coming through. So make sure you've clicked on the links before I conclude the session, because then I don't know if you will still have access to them. Matthew, thank you again for joining us today and for your insightful presentation. Folks, and I can send the links again, yes. Folks, we will upload this talk as soon as we can on YouTube. So you can always revisit some of these points that Matthew made. And as he said, you can always reach out to him. Matthew, I don't know if you can see the chat, but you've got people thanking you for your presentation.
Yeah, thank you all for your comments and for being here. And thank you, Thanos, for putting this together. I really appreciate it. It's been a pleasure.
Okay, thank you all. Keep an eye out for the next behavioral talk. I will be promoting it soon. And Matthew, thank you again. And cheers, everybody. Take care. Bye-bye.
Bye, everyone.